Did you know that trauma, even from years ago, can actually trigger functional neurological disorder or FND? So if your teen has sudden symptoms like tremors, shutdowns, trouble walking, or even functional seizures, and then someone mentioned trauma, but nothing is really adding up, this video is really for you. Because while trauma can be a trigger for FND, it is not the whole story, in case you're wondering. And missing the full picture can actually keep recovery out of reach. So stay with me because this part is really important. In today's video, we're going to talk about what trauma actually means, how it's possibly connected to FND, and more importantly, what can you do with this information to move forward towards recovery. So let's dive in. Hi, I'm Dr. Lee. I'm a pediatric health psychologist and the founder of Teen FND Academy, which is an online coaching program to help teens with FND and their parents to get their lives back beyond FND. When most people hear the word trauma, they think of one big event. We call it trauma with a big T. But in brain science, especially related to FND, trauma does not really only mean something huge or dramatic. So trauma can be, for someone, a concussion. It can be a medical procedure. It can be a school stress, social rejection, loss, or just chronic overwhelm. For teens, it could be just being told no. It could be their reality was denied. Like, no, that's not true. You should feel this way. That kind of thing. And some of these things might be like, oh my gosh, is that it? Really? So that is really the question about trauma with little t, because it's literally anything that made the brain feel unsafe, out of control, or it had to go into this survival mode. And that is what any quote unquote trauma does to our brain and the body. And here is something families doesn't often realize. Something that happens a year ago can still affect your teen's nervous system today. So it doesn't have to be, oh, this thing happened and then FND started happening right after. If you're looking for clarity on where recovery starts for FND, the Family Guide can help you. It's a snapshot of our recovery system and it is completely free. That is in the description box below. So now let's talk about how trauma and FND are actually connected. FND is a brain-body miscommunication problem. It is a real diagnosis, and basically the brain is not sending the right signals to the body even though the structure of the brain is fine. Same thing, the body is also sending confusing signal back to the brain, so they're really having this miscommunication problem even though there is nothing physically going on. So trauma does not cause FND by itself, to be clear. However, trauma can change the way the brain handles safety signals. See, this is where the miscommunication can happen. So if the nervous system stays stuck in this fight, flight, or frozen mode, then the brain might misfire even when after a threat is gone. So even though your child is feeling fine and there's nothing wrong and just chill, suddenly the symptom can happen. So you might be thinking, oh my gosh, yeah, but there's nothing stressful going on at that time. So that is where the tricky part comes in. So when we say trauma can be a trigger, we're actually saying the trauma trained the brain to stay on high alert, hypervigilance, even when nothing dangerous is really happening right now, because it doesn't really know when to turn it off unless it is learned to turn it off. So here is where things get often confused. Many families are told FND is just trauma, just do therapy. So they try traditional trauma therapy or medication, EMDR, all kinds of things, but nothing really changes, at least on the surface. Why? Because FND is not just emotional trauma problem. It is also neurological, social, physical. So calming the mind is helpful and working on the trauma at the core is absolutely helpful, but that is not it. It's not enough. We have to retrain this brain and body loop. And the answer isn't in that place of, let's talk about what happened with this trauma. So let me ask you this. Have you tried therapy or medication for trauma, but your teen's physical symptoms and FND are not getting better? If that is the case, you're not alone. Some teens with FND have no trauma history at all. As you can imagine, statistically speaking, it's actually less than 50% of the time. For for pediatric FND patients. And for adults with FND, the percentage of having some sort of childhood trauma or adverse event is much higher. Others had something tough happened years ago, but symptoms show up only recently. So it's not really one-to-one. And that is because FND usually develops from a mix of layers, like I talk about all the time. These are what I would call it 3 Ps. Predisposing factors is a 1 P, which was basically cooking in the oven long before that. Second, there are precipitating factors, what trigger the symptoms. And the third P is the perpetuating factors, what keeps the symptoms stuck now. So basically what's keeping the fire of FND alive. So yes, trauma can be part of the story, but it's rarely the whole story. And that is actually, in a weird way, good news, because it means there is more than one way to help your teen recover. So how do you know if trauma might be playing a role for your child? These are the few questions you can ask yourself. Did your teen go through something medical, social, or emotional that felt overwhelming? Doesn't have to be dramatic. Do they freeze, dissociate, or shut down when they're stressed? Do these symptoms flare up when they're reminded of past events or anything resembling that stress? So if you are answering yes to anything or all of the above, then trauma might be part of the picture. But don't stop there, because your teen still needs a plan that works with the brain, body, and the whole nervous system, not just emotions only. And that is how they get their control back and get their life back, step by step with baby steps. I explain exactly how the Teen FND Academy program helps teens get their lives back with real examples from families who have gone through the program and already recovered and got their lives back. You will find the video in the description box below. And if you want to learn about the other factors that can cause FND, like what many doctors miss, go watch this next video linked right here on the screen. Thank you so much for watching this video, and I'll see you in the next video.